everyone. This is Dr. David Spiro. I am a professor of pediatric emergency medicine at UAMS and Arkansas Children's Hospital. And this is another episode of Human Medicine, or HuMed, as we call it. And we're excited to have you all listen today to a very special guest, Dr. Jessica Allen, who's with us today. Hello, Jessica. So, Jessica, why don't you tell us a little bit about yourself? I met Jessica in my previous role as a chief medical officer of an independent review company, where I learned a lot of lean-based thinking and was in a different role than I am now as the section chief of an emergency department for children, and really connected with Jessica on a personal and professional level. And we've continued to stay in touch, and really glad to have her on the show today. So Jessica, can you tell us a little bit about your background in healthcare and education and sort of how you came to being here today?
Yeah, absolutely. Just want to say thanks for being here. It's always a privilege when I can share space with you. You've always got just such innovative and wonderful things going on. I am educated as a chiropractor. I went to Northwestern Health Sciences University, graduated in 2010. I also worked as a massage therapist before that for, oh gosh, about 7 years. So if you put all of it together, I've been fixing people for 22 years now, so that's a really long time. I met Dr. Spiro, like you said, through an independent review organization. Um, I landed here with kind of a mix of active practice and non-clinical work, partially due to sort of life circumstances, but a lot due to my personal interest. The story kind of ties in with that. I was very fortunate with my first job that I worked with a family clinic that was um, very integrated into medicine being a system, the healthcare system, and everybody's got a role to play. And chiropractors are awesome, but we have our wheelhouse that we are in, and there's other people that have other wheelhouses that can be wonderful to help serve our patients. And through them, I learned how to do everything 1,000% by the book, whether it came to Medicare, car accident patients, however it needed to work. He was also the main doctor there was Titleist certified. We worked with a lot of athletes of all different types. That kind of set the tone for what I'm doing right now, practice wise. But everything by the book. And once I left that little nest, I found that a large portion of just practitioners in general didn't really hold that integrity. And so I incorporated some non-clinical work, some peer review work to hopefully help everybody grow in their documentation and understanding of insurance policies and guidelines and that sort of thing. And to a certain extent, the rule book exists for a reason and protocols exist for a reason. And if you follow them, then either the patient gets better or you know exactly what to do. If you go too far outside of that, you either don't have support or you're getting unexpected results. And anyway, so my
So
story
Jessica,
today.
I think there may be some listeners. I was one of them before I started working for a review organization that really just doesn't folks don't always understand, especially if you're not in healthcare, which is very complicated as you described. And also I agree with
Yeah.
you, a system of care. Can you describe a little bit about what you said you got involved in peer review? So can you talk a little bit about what that is and how that supports patient care?
So peer review is typically the person you don't want to hear from. It's like, oh my gosh, I've got a peer review call. Are you serious? I got to talk to some weirdo that has no idea who my patient is or what I'm doing or what I want to do. And how dare they think that they know what's going on and that sort of thing. And so I'll get questions from these organizations. Oh, is this 6 sessions of chiropractic care medically necessary? Is this lumbar MRI medically necessary? And it's my job to figure it out if it really is necessary. And part of figuring that out is trying to contact the provider. And I've learned over the years, 8 years, there's some ways that you can help guide the conversation that makes it a little less confrontational, I guess would be the word for it, because it's not meant to be that way at all. My main job is to gather information about potential extenuating circumstances. It might be that the the notes that get my way might be the first visit with that particular chiropractor or physical therapist or somebody that's in, the physical medicine wheelhouse. Might be the first note with that provider, but the patient went to 2, 3 other people and has been trying for a year to get their low back pain or whatever it is resolved. And therefore, requesting an MRI might not seem so crazy as, hey, this is my first visit with this patient and I want to order $1,200 worth of imaging. So
Sure.
that's a big goal, is to gather supplemental information that might help us support a request. And if we can't, I'd like to think that another big portion of my job is to explain why. Like, here's your notes, here's the guidelines, here's where they don't match. I can't tell you what to do, but I can tell you what's missing. I've have found a lot of providers to have um, a very varying response to my insertion into their business. But overall, I have found the experience to be really valuable and I have a good time with it. So,
But the reason for and I appreciate that, but the reason for the insertion and peer review is you're reviewing records that other chiropractors are involved in. And my understanding is you're not telling these doctors what they can and can't order. It essentially is whether the insurance company the payer will, if it's medically necessary to pay for the MRI at the first visit, or they need 6 treatment sessions and then maybe an MRI or physical therapy or whatever needs to happen to sort of get the test done. So would love to get into, so that's a great background and it's really interesting, and would love to hear a little bit about the story you want to tell.
so like I said, this is way back to where my very first job, who's also I interned with this family at the very end of schooling. I was actually pregnant with my first daughter, and how they helped me go through that whole process. And then when I was ready to return to work, I couldn't think of anybody else I wanted to work for. So I was very fortunate they made a place for me. And this patient came to me within the first couple months of seeing patients independently. He was a younger man. He was about my age at the time, and this was in Dallas, and he had a job behind a desk downtown. Anybody who's familiar with the Dallas-Fort Worth Metroplex, commuting in that city is no joke. So he was at least an hour, hour and a half in the car to get to work, back home from work, and he also played in a band. And he was loading up his equipment after a set, lifting, twisting, felt, terrible low back pain, had a really bad catch, shooting pain, numbness, tingling. He said he was already hot and sweaty from playing and then loading stuff. And he was like, I looked down to see if I had peed my pants because I was just already so tired, so sweaty, and I had no idea what was going on. And I can't remember anymore, but there was someone in his family that worked in healthcare. So he calls this person and says, oh my gosh, I have no idea what's going on, but I'm just in horrendous pain. And this person had told him, well, you need to go see a neurosurgeon, like right now. So he called his insurance company the next day to see which neurosurgeon he could get in with. The insurance company says, well, you can't just walk into a neurosurgeon's office. You have to have a referral. Okay, well, where am I going to get this referral from? And they said, you could go to your primary care doctor. You could go to a chiropractor. And he was like, okay, I've got a chiropractor down the road. I'll go see them. I'll get this referral. So by the time I'm about to go in with a patient, the support staff had informed me that this patient's only here for a referral. He's in a ton of pain. I don't know what you're going to do, but here he is. So, okay.
Wow.
So I walk in and he's still sweating. He's not sitting down. A little bit of distress. It tells me the whole situation. And he's like, I know that I've got to have back surgery. I need to go see a neurosurgeon right now.
Mm.
And I said, okay, well, let's do a little assessment here. Let's see if we need to go neuro or if we need to go ortho. Did a thing, all the neuro testing, reflexes, muscle strength, all that kind of stuff, all the orthopedic testing, took some x-rays. And I said, yeah, if I were to pick one, I would say neuro. We've got a few people that we really enjoy working with, but I need to let you know, they're not going to have any availability tomorrow. It's probably going to be 4 weeks, 5 weeks, maybe even 6 weeks before you can get in. So would you be opposed to trying a little bit of treatment while the time passes? Like, we're going to have to chew up this time one way or another. So here's your referral, filled it out, signed it, called the office, all that stuff while he was even still in my office getting treatment. And he said, okay, that makes sense. Let's do this. So the first 2-3 visits go by and not much happens. And he's got a pretty doom and gloom attitude about his ultimate fate in low back surgery. But by visit 4 or 5, he started to say, hey, I only had to stop once on my way to work to get out and stretch. And that's a pretty big deal. he, he was telling me he got used to seeing the same people he had to stop 3 times. And then once he only had to stop once and it was in a different place, he was like, I got to meet new people at this tire shop or whatever. And so, that's the part that stuck out to him, is that he made it a lot further before he had to stop. So we get him to feeling better, and it's a couple days before his appointment with the neurosurgeon. And I said, it's okay to cancel. It's wonderful to go, but if you feel like you're all put back together, feel free to cancel the appointment. And he said, no, I'm going to go. And I'm going to tell this neurosurgeon all about how you fixed me and the rehab exercises and all this stuff that we did. And it kind of circled back to how somebody in his family worked in healthcare. And he was like, this neurosurgeon's got to know about what you guys have going on here. So, which was really fortunate for it was like a big feel-good situation. The neurosurgeon got to understand that we kind of knew what we were doing over at this other office, and we weren't just like a mill cracking backs and sending them out the door. It was really helping people feel and function better. And it was a really good lesson for me, because if treatment hadn't worked out for this particular patient, I would have gotten him exactly where he needed to go at the very soonest moment, because I had written the referral on the first visit, which, as you know, is not the most typical thing.
Mm.
But this person had an urgent enough of a situation where I felt like it would have been justified. So I had made that referral, and luckily for this patient, he got better with conservative treatment. But had he not, he would have been able to really smoothly go from one place to the other, instead of going through the full 10, 12 weeks of treatment like a lot of conservative practitioners do, then think about a referral, and then wait the 6 weeks for the calendar to catch up from the specialist and that sort of thing. So it was just a really good lesson all around. Luckily, it worked out for this guy that everything got taken care of pretty easily. But that really, gosh, it just set the entire philosophy for my practice moving forward, is that healthcare is a system, and we all got these roles that we play, and it's just a whole lot better for everybody if we work together.
So that's a great story. And interestingly enough, I developed low back pain, and my injury was the handheld 1930 style lawnmower,
And-
the one that you push on an uneven lawn surface. Came back and I think I took off my shoes and bam, went to the floor. This was probably about a year ago, and it was a 3 or 4 month process before actually I got out of pain. And maybe I'll share a little bit about it. So I actually really relate to what this gentleman had, and there's so many Americans that suffer from chronic low back pain. I think the other thing you didn't mention for the audience to know is, and correct me if I'm wrong, Jessica, but you also have experience taking care of elite athletes and helping them get back to function as well, which I think is awesome. So I want to start back from the beginning. So when this person came to your office and you made the referral and he was in a lot of pain, um, from a chiropractic standpoint, what kind of things what modalities did you trial on him? If you could speak in layman's term, and for those of us that are not chiropractors, from a Western medicine standpoint, yes, I think there's some people that have very crude understandings of what chiropractors do, and I have found that many of the chiropractors that I've worked with personally over time have been really helpful. For example, when I was a resident, I was having some lower back pain, and this was back in the days when we carried a lot of cash around, and guys had very big wallets. And
oh, yep.
when he did his assessment of me, he noticed I had a hip tilt, and it was because I had this big bulky wallet sitting in my pants. And he said,
Yep.
you should put the wallet in the front of your pants or somewhere else, because this could be the origin of your issues. And it actually really helped me relieve pain. So would love to hear with this particular story what you did for this gentleman who came in with this acute onset of back pain, and what you actually thought was going on with his back.
I was pretty sure that it was something, maybe not a disc herniation, but something we just kind of generally refer to as a hot disc, where there's some swelling and there's some inflammation at a really localized level. And when you have swelling and inflammation at a particular level in anywhere in your spine, but particularly in the low back, you can get some kind of lightning bolt sensations, numbness, tingling down really particular sections of your legs. And that can give people a lot of anxiety because, or like, let's say it's the hand, they'll say, why is it numb and tingly right here? But like here's fine. And that is the part that really gives people a lot of anxiety is, if they hit their hand and their hand hurts, that's explainable. But if they haven't hit their hand and it feels weird over here, then like, okay, there has to be something more serious going on. So that's what was happening with this young gentleman. Treatment at the very beginning was a lot of anti-inflammatory type modalities, so lots of ice, lots of e-stim, more of like manual stretching, not a lot of what you'd typically think of going to a chiropractor with, like the big pops and snaps and laying you on your side and jumping on you. That has a time and place, but not when somebody is super acute. Kinesio tape was kind of a newer thing at that point in time. So I had him covered all over the place with some kinesio tape. I don't believe I gave him a low back brace because he had a desk job and he was fine not lifting his band equipment. He could, like the other guys could do that for a little while. So I don't think I had a need to give him a low back brace, but he was definitely covered in tape. Um, let's see. We had several protocols, exercise protocols there. I had these nice sheets that I could print out for people. I always walked patients through exercises myself, and I would do them in front of the patient. And I'd say, okay, you can use a broomstick, you can use a golf club, you can use whatever to help support and help stretch. And here's what we're going to do. We're going to do these isometrics at the beginning, meaning you might not move your body a lot. You might not even feel like you're moving your body at all when you do these first stretches, but they're really important for stabilizing your weight and your core so that the motions we build after that can happen a lot easier for you. And then you don't get back into this spot anymore. So that would have been first phase is more of an isometric, lots of ice, kinesio tape, really gentle motions. Towards the end of treatment, a little bit more rigorous with the exercises, some reps with like squats, maybe with a little bit of weight, maybe not, just depending upon exactly what type of circumstance we have going on. Lots of guidance on what to do once you get home. If is it okay to go for a walk, is it a jog, should you just maybe walk up and down stairs a few times where you've got a handrail you can hold on to, that sort of thing. But as time goes on, the protocols get a little bit more rigorous, and hopefully, by taking the time to step back and say, okay, what happens to my body when all I do is hinge forward? Am I activating the right muscles at the right time? Am I doing this with correct posture? That sort of thing. Taking that opportunity to step back, build stuff up from the beginning. The hope is that you prevent future situations from happening. So that's always the approach I've taken is still incorporating the whole body, even if it's something like a low back that is the main problem. It's still addressing core and still addressing strength, to make sure that not only are we addressing the issue at hand, but we're preventing it from happening again.
Well, I think that's great. I think, again, there is a misperception on by Western medicine about what chiropractors can and can't do. I also have found that many chiropractors I've worked with really have an understanding, thinking more holistically about healthcare rather than just in Western medicine. Um, we tend to be what I would call at times reactive. In other words, you have a disease process. Here's a pill, or we're here to diagnose your disease and then treat it. I find that as I'm aging, that it's really important to be thinking about what we all can be doing to actually prevent disease. And one of the things that I always think about are the core pillars of health, which are sleep and diet, and exercise, but but being mindful of what kind of exercise works for your particular body. Everyone has different things they can and can't do, and ways to control stress in one's life. And stress is a hard one.
Yes,
And so I wanted to get into the stress question because it is a core pillar of health, and it's an easy thing to say, well, lead an unstressful life and you'll live longer and happier. Go
yep.
ahead. Good luck. Uh, but but how how do you think about that in terms of reducing stress in one's life? Because there has been, I know for sure, both personally and with friends and family, that there is a relationship between stress and back pain. And it almost
For
seems odd
sure.
to me, but can you explain that as a chiropractor? Why is that linked? And uh, I don't know if Western medicine has a good answer for that.
I don't know if I'll have the perfect answer for it either,
No,
but
perfect. This
um
is human medicine.
that's
We're all
that's right.
imperfect.
Okay. I think a lot of that really comes from your breathing. And I think this could lead to low back pain, but it can also lead to headaches and things of that nature. So when people are, let's say, liking to walk around with their belly tightened up so that no one can see what's going on in the middle, or if there's a lot of stuff going on and you're having to both type on the keyboard and talk on the phone, or you're driving and drinking a coffee. And so, um, and even just holding your arms forward. So the first thing we do is we get up and we eat breakfast, and then we drive to work, and then we type on the computer, and then we eat lunch, and then we drive home, and then we're back on the computer and the phone. So all of this is just really crunched up here. It forces you to use your accessory breathing muscles, and things like your diaphragm and your other core muscles aren't doing what they're supposed to be doing. And a lot of that is supporting that low back. So even something as simple as mindful breathing exercises. And if anybody wanted to go back to the beginning of the podcast, they probably saw me pause, take a couple breaths, get back into what I was talking about, because I know that's a quick default of mine is I just start talking faster and my voice gets a little higher, and it's okay. And to slow down, take a breath. Belly breathing is huge, not just for your breathing and your diaphragm, but also for that low back too. And a lot of it goes back to posture. Also, if you're holding yourself really tight with your shoulders forward, a lot of people will stick their butts out, and they might not even know that they're doing it. You wouldn't know that unless someone took a picture of you, or you happen to catch a mirror at the right angle. But walking around with an anterior pelvic tilt is a really good way to crunch up all those vertebrae in the back and lead to some muscle spasms and to some pretty significant low back pain. Um, Another one, when it comes to the driving, the wallet in the pocket is first thing I ask pretty much all men. Where's your wallet when you're driving? And the length of time that you're driving, that can really lead to a lot of imbalance in your deeper glute muscles and in your leg muscles. And anytime you've got an imbalance that way, that's also a really good way to escalate some low back pain situations. So um, the little things matter when it comes to stress management and your posture and things like that. I have I've gotten to where I don't carry a lot of products anymore, but I've got a short Amazon list that I just send to patients when they come in of typical posture correctors that seem to work for a lot of people, or like your basic low back brace that comes with a lot of instructions. You can't just wear a low back brace all the time, but things that seem to work for a lot of people. I've got that sort of stuff saved and can be a pretty quick resource for everybody. So if we circle back to the breathing, there's a really quick grounding exercise that I actually have my kids. They could tell, I could wake them up in the middle of a REM cycle and they'd be able to recite it to me, the 5 4 3 2 1 grounding. So if you're in a situation where things are just kind of building up, and the trick is to try to get to it before you get to that snapping point. So if you're driving in a car, maybe you're dealing with your own kids, maybe you've got a lot of staff issues going on at work, you can kind of feel that like face getting red, blood pressure's going up, situation going on. You want to get to a stress reducing routine before you blow your top.
So
So when you first feel
can you
that,
take us through that? Take us through what that is. You said it's the
yes,
5 4 3 2 1.
5 4 3 2 1 is my
Tell
favorite. So
I haven't heard that because Andrew Huberman, a huge fan of Andrew Huberman. If you're listening, hi Andrew.
yeah,
He's not listening
hi.
yet, but he will. He is a pretty well known Stanford trained physiologist who is really talks a lot about breathing, and he's talked about some different breathing techniques. So, but I haven't heard about the 5 4 3 2 1. I would love to hear about it.
Yeah, so it's 5 things you can see, 4 things you can touch. Oh man. Touch, see, smell, and the last one's taste. So touch, taste, hear, smell, and then taste. So if you've starting to kind of feel a little bit out of control, just look at 5 things you can see. Like I can see Dr. Spiro and I can see my computer screen. I can see my coffee cup sitting next to my computer. Count out 5 things. Just distract yourself from the situation for a moment. You're going to get a little bit better control of your breathing. And then, okay, 4 things you can touch. So not only can I see the coffee cup, but I can touch it too. And I can touch the mouse and I can touch the keyboard, and I can touch my notebook I have in front of me. And then 3 things you can smell. Um, no, 3 things you can hear. So I can't hear too much right now, but it might be the other traffic going by, the birds singing outside. Even if it's the kids that are getting at you, you can hear your kids. Um, Whatever it is that's going on. If you're at the hospital, you've got all kinds of beeps and boops that you can hear from several rooms. Count that out, and then smell and taste for both of those. If you can't smell or taste anything right now, then think of your favorite thing. So
Mm.
um, if you're at the hospital, it might not be rubbing alcohol as your most favorite thing to smell, but you might like a peppermint hot chocolate or something like that. So I think of your 2 favorite things to smell and your favorite thing to taste. Takes, gosh, under a minute to do, but it can really take you from blowing your top to no longer blowing your top. And you're able to focus on the next couple decisions that you need to make, the next couple interactions that you have with your patient, your staff, your parent, teacher, whoever it happens to be. That has been our serious go-to, raising both my kids, and in situations I didn't learn about it until I had kids that really needed to learn how to regulate
Mm.
themselves. And then once we all got used to doing that as a family, it's like, wow, that is a really powerful thing. So that's called the 5 4 3 2 1 grounding technique, really helping to regulate your breathing. And even just adjusting those couple things can really decrease that stress level and get you back into, okay, shoulders back, feet far apart, belly breathing, not holding, like nobody's in a corset anymore, nobody's looking at you. And those little things that can really either treat a low back pain situation or headache situation while it's going on, or prevent the next one from happening.
Yeah, I'll share quickly a little bit of my own story. I had mentioned to the audience that I had lower back pain, and mine was I had a sciatic component to it. So it not only involved my lower back, but down my leg, and it was so unpleasant. Um, but I actually, and I'm curious I've never talked to anyone about this, but I had a series of things happen. I got COVID last summer, and just standard COVID stuff, cold, little fever, got over it. And then about a month after getting COVID, I got shingles, and healthy
Oh
dude,
no.
all of a sudden it was on my arm, and that was a whole weird thing for a couple weeks, and then the shingles went away. And then a couple weeks after the shingles, I got, I had the lower back pain after the lawnmower incident. And I've thought about it, and it's like, sometimes we think, at least my training is that, lower back pain, oh, I worked out too hard and now I have lower back pain, or I was did something weird with the lawnmower on an uneven surface, and that was the problem. But it may have been related to the fact that I had COVID, and maybe for a period of a few months, my immune system was shot,
Right,
or
yeah,
I
absolutely.
had higher levels of inflammation in my body, and yeah, maybe using the lawnmower was the precipitant, but maybe the real reason why the lower back pain occurred originally was because I had COVID, and it's interesting because it was COVID, and then after I was so happy because I was going to visit my best friend in Europe every summer. every other summer go over there and hang out with him. And sometimes we do saunas over there because they're big sauna culture.
Nice.
And saunas, by the way, have been shown, evidence-based medicine, hot
Yep.
sauna has been shown to actually really improve quality and quantity of life. But go over there and I did a fast. So I got COVID. I did a sauna and fast, which is a good thing for the body,
Yes.
but maybe not so good after COVID and your immune system is weak. Then I got the shingles and then I got lower back pain. And
Man.
I actually think it's all related. Who will know because it's David Spiro's body, but
Right. Yeah. It's
but
Derek
I think it's
and
related, you know?
yeah, there are some interesting just progressions of what happens to people. And that's why, that's another reason why I think it's a pretty big job of us in conservative treatment to do that step back with the patient. And yes, of course, we're here for low back pain and we're going to do everything we can to address that low back pain. But if we take that step back, if we're going to support your entire core, we're going to teach you how to build that core back up from the beginning, get that pelvis stable, all those sorts of things, then that's going to set you up for a way better situation moving forward. So yeah, the whole psychosomatic thing is really interesting too, just what you can will yourself in and out of. And COVID is a very stressful situation. Even, obviously it was more stressful at the beginning, but even now there's like things you feel like you can't do because you have COVID, and places you feel like you shouldn't go because you have COVID. And it takes a big toll out on you because it's just gotten to be a really stressful thing. So, could that be something that weakened your system enough to that's where the shingles came from? You can't say it didn't.
Yeah.
So,
Yeah, and then also you throw in. I mentioned some of the core pillars of health, and you mentioned, you talk about sleep, and maybe COVID disrupted my sleep, and then I was more stressed, as you said, like trying to figure out when can I go back to work and see children again safely, and then
yeah.
all of a sudden the direct effects of COVID on the immune system and inflammatory process, and then boom, shingles and things show up. Well, we're getting to the end of our podcast. I want to say that it was so delightful to have you on, and that was such an incredible story. And I really appreciate you as a human being, and also your approach as a chiropractor, and being a little bit vulnerable and sharing your story and the 5 4 3 2 1. So I always ask my guests at the end of this if you want to share, if you wanted to share one thing, one or two things to take away from what you wanted to bring to the HuMed podcast, what would those one or two things be?
Um, I think the big message would be that healthcare is a system and we all have our place. It kind of goes both ways too. If you think of a lot of other practitioners in the natural medicine realm, I think to a certain degree is self-perpetuating in that a lot of us seek out alternative forms of medicine because we've had a bad encounter with traditional medicine, and maybe there's some sort of grudge or something like that. But we all have our parts to play, and for I would think anyway that your audience is probably more on the traditional medicine side, which is a wonderful thing. My kid's pediatrician is one of my speed dial numbers. He's a great guy. So, and I've never hesitated to network with any type of specialist. And then in the other work that I do, I'm on the phone with specialists more often than other chiropractors. So, it's something. If there's one gift I could give to chiropractic, is that medicine doesn't hate us at all. There's a huge misconception that just all the medical doctors hate us. Well, you know what? All the medical doctors give crap to everyone equally. If that is one thing I've learned in 8 years of doing peer review, is You'll have the ER doc make fun of the ortho for forgetting all of their anatomy, and you'll have the cardiologist making fun of the anesthesiologist because they take their rolly chair with them everywhere they go. And it just is, if you're the butt of the joke, that means you're part of the team. And so that, if I could give that to chiropractic, that's what I would give.
Great.
um,
Well, you're awesome, and great story, and thank you for being a guest on HuMed. This was a great conversation, and appreciate you. So for those of you who are listening, please follow us on Spotify, YouTube, or wherever you listen to your podcasts. Thank you for joining, and I hope you all have a great rest of the day.
Thanks for listening to HuMed with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.